Medical debt. It's an issue that affects 1 in 12 adults across the United States. But how does it impact Washingtonians? Seattle University Associate Professor Aaron Vernon says that while there is work to do, Washington does not overall have high rates of medical debt.
Yeah, so Washington is definitely not above the mean, but it's also not one of the poster states either. I think the state has relatively strong safety nets for vulnerable populations.
But as it turns out, medical debt is still affecting patients close to Seattle University's campus. Providence Health and Services owns several hospitals in Washington state, including the Swedish Medical Center, which is located right next to Seattle University. Last year, Providence was ordered to forgive $137 million in debt to patients. This order came in the form of a legally enforceable agreement from former Attorney General Bob Ferguson. The state alleged that Providence violated Washington's charity care laws, which requires hospitals to provide financial assistance to income-qualified patients. The state says that Providence routinely disregarded its legal obligations and trained staff to aggressively ask for payment from patients who are likely eligible for financial assistance. As a result, the state required Providence to forgive more than $137 million in medical debt and refund an additional $20 million to patients billed when they would have likely qualified for financial assistance. Providence spokesperson told Lee TV that going forward, Providence will continue all efforts to ensure that patients are fully informed about the levels of financial assistance available to them, and that constantly evaluating these efforts will be a top priority moving forward in 2025 and beyond. Bonnie Bowie is Seattle U's Associate Dean for Graduate Programs. She says that there are ways for Washingtonians to report problems with medical bills.
I think Washington's doing, considering our system, I think we are doing a pretty good job. And we typically, but we do have an insurance commissioner at the state. And typically, so if you have a problem, you can go to that office and file a complaint. And my experience, which has been a while ago, they were very, very helpful.
From Lee TV, I'm Caleb Stipkovitz.